In this lecture, we will continue our discussion of personality assessment by looking at a second category of personality assessments, projective personality assessment. There are various types of projective personality assessments that we will look at. All, however, are based on the same fundamental premise. At the root of all personality testing is the projective hypothesis. The projective hypothesis states that when individuals attempt to understand ambiguous or vague stimuli in their lives, their interpretations of those stimuli reflect their basic needs, feelings, experiences, prior conditioning, and thought processes at that given moment. In other words, our interpretation of a situation or a stimulus is based largely on who we are, where we come from, and where we are at the given moment. These needs, feelings, and beliefs are deeply rooted inside of ourselves. The goal of projective testing is to get at those unconscious thoughts and motivations. Throughout the various types of projective tests, ambiguous stimuli can be presented in several different forms. You may see the use of pictures, abstract images, words or phrases, or incomplete sentences. The use of projective tests is certainly not a fad or a recent phenomenon. In fact, projective personality tests have been in existence and a critical part of clinical assessment for many years. Here you see the results of a study conducted amongst professional psychologists that asked what instruments were they using most frequently in their clinical practice. You'll notice the top two, the Wechsler Adult Intelligence Scale and the MMPI-2, the two gold standards in assessment, are followed by a number of projective personality tests. In fact, 4 of the top 7 most frequently used tests in the United States are projective personality tests. Looking at the entire list, you can also see the projective tests are more common than most intelligence or clinical assessments. The frequent utility of these instruments speaks highly of their practicality and ability to contribute positively to the therapeutic process. If we were to take all of the various types of personality assessments that use projective testing, there would be many, many instruments from which we can choose. An earlier attempt to organize these was conducted by Koppitz. In your textbook, you will see how Koppitz identifies 5 techniques that can be used to assess personality. These include verbal methods, visual methods, drawing methods, manipulative methods, and assembly methods. We'll spend a little time discussing each of these and pointing out some examples of commonly used assessments that fall into these categories. The first such category are the verbal techniques. These are assessment inventories that require a verbal stimulus and response. Both the stimulus and the response can occur in writing or be delivered orally. The key component here is that the individual has to respond to words using words. Some common verbal techniques are projective questions, asking individuals questions such as, imagine that you were placed in charge of the world. What would you change, and how would people's lives differ as a result of your rule? The client's answers would reflect some of their needs and wants in how they would like life to look. Other examples include sentence completion or story completion. Here, the clinician prompts the client with the beginning of a sentence or a story, and the client has to fill in the blanks or finish the story. Another type of approach are visual techniques. Visual techniques are presented to a client and a verbal response is given. So the client looks at an image but provides verbal, language-based responses. Perhaps the best known example of the visual technique is the Rorschach Inkblot test. Visual techniques such as the Rorschach are successful because they require individuals to project their internal self or personality into their responses. The ambiguity of the items is such that an individual's response has to come from who they are and how they envision the world. So let's talk about the Rorschach Inkblot test. It's one I'm sure many of you have heard of before. Initially, when it was developed and released, it was not met with critical acclaim. In fact, many people found it to be a foolish instrument that shouldn't be used. It wasn't until much later others began to reinvent the instrument and redefine the scoring procedures associated with it that it gained popularity and became used widely in assessment procedures. The version used today is very similar to the original version that came out over 90 years ago. Clients are shown 10 symmetrical ink blots. If you were to take the card and fold it in half, each half would be a mirror image of the other. Some of these cards are black and white, and some are multicolored. Individuals are shown these cards and are asked to report what the picture is, or what do they see. Additional information can be gathered by quizzing clients or following up with them after the test about where their responses came from. What was it in the picture that made them respond the way they did? So let's look at a couple examples of Inkblot cards. So here you see a black and white image, and clients would be asked to report what it is that they see in this picture. Here you see an image that incorporates a single color, red. And then advanced level, a multicolored image. The directions remain the same for all the pictures. Clients are asked to report what it is that they see. In terms of administrating, the card is handed to the client. They're asked what they see, and your job as the examiner is to write down word for word or verbatim the client's response. You also will note reaction times and duration of responses. How long did it take the individual to formulate a response? And then how lengthy was their response? Was it short, a few words, or did they speak at some length about what it was that they saw? You would also make note of how the card was held and what parts of the image led to the interpretation. Additionally, you would make note of any remarks or expressions that came up throughout the process. Perhaps a client broke down in tears at one of the pictures, or started laughing to themselves. You would make note of these expressions in your score reporting. Each of the cards are administered to the client twice. The first time is free association. The only direction is, what might this be? And clients respond what they see. If they appear unsure or really don't have a clear idea what it is that they see, follow-up questions such as, take your time, or could it be anything else, may be asked of the client. Once all the cards have been administered a first time, a second administration occurs. This is the inquiry stage. Here, clients are presented with the cards, and the counselor recaps what their response was to that card. This serves two purposes. First, it allows the clinician to double check to make sure that they accurately heard the client and what the client said. Second, it allows for a more qualitative follow-up. Counselors now ask questions such as, what made you say that it was this? What parts of the picture led you to believe that that's what you saw? What did the picture make you think of? And so the information gathered here offers a richness that may not have been achieved in the first administration of the cards. There are several components of the response you look at. First, you would look at the location. What part of the picture did they use to make their response? You would look at determinants. Did they use any attributes of the stimulus, such as the shades of the colors, the brush strokes, or lines and symmetry of the image? Do they see any movement in the picture? Or is it a static object being observed. You also could look at content. What is it that they see? And then finally, you look at popularity. With each card, clinicians are given a list of responses that have been gathered and collected over thousands and thousands of administrations of the instrument. An individual client's responses are compared to those previously gathered responses. Those that are similar or alike are scored one way. Those that are obscure, odd, or deviant from what the norm typically sees in these pictures are red flagged, and these are areas that we would want to follow up with the client with to determine what exactly is going on with this individual and what might their thought processes be. A second type of projective testing is the drawing techniques. Drawing is a way for clients to express themselves without having to use language. Drawing is seen as a way for individuals to depict or illustrate their own lives, how they view the world, how they view their place in that world, and what their perceptions of the world may be. There are many different types of drawing tests. The Draw a Person test, the House Tree Person test, and the Kinetic Family Drawing test. Each has a different way of interpreting the image that clients are asked to develop. Here are some examples of kinetic family drawings. Clients are asked to draw a picture of their family engaged in an activity. Now note that there's a lot of ambiguity here. What type of activity? Work, play, leisure? It's left up to the client, whatever activity they choose. That activity then becomes the focal point of a discussion following the drawing, in which we try to understand why the client chose that activity. What meaning or value does it have for them? Here's another example. Notice that individuals are allowed to determine what family is for them. You may choose to draw your nuclear family, your extended family or family of origin. It may be a small group or a large group. These approaches are often used with children who may find it difficult to talk or express themselves, particularly with an individual with whom they are not familiar. Another type of testing, the fourth type, is the manipulative techniques. Manipulative techniques are also useful for individuals who have trouble expressing themselves. These individuals also may believe that they don't have much artistic ability. Manipulative techniques allow clients to interact or employ objects to tell their story. Examples include puppets, toys, clay, modeling clay. You also see sand tray therapy, a popular manipulative technique. Through their play or creation with these objects, clients share their story. In that story, we pick up clues or evidence of underlying issues, personality disorders or development, as well as a better understanding of how they view the world around them. The final type of projective technique is the assembly technique. Assembly technique requires clients to put together an idea or story. Given incomplete parts, the client fills in the blanks, puts the entire picture together, and shares a story. It's that story or completed image that gives us some insight into the client's subjective world and perceptions of their own reality. Two of the more popular assembly techniques are the Thematic Apperception Test and the Rotter Incomplete Sentence Blank. First, let's look at the Rotter Incomplete Sentences. These are a few examples of items on the Rotter test. Clients are given a sheet of paper that has a number of items, and they are asked to complete each sentence. So you can see in the first, I fear, could then fill in what it is that they fear. It could be brief, I fear spiders or heights, or it could be more descriptive and tell a story. I fear coming home one day and finding that my friends and family have all left me and abandoned me. Another type is the Thematic Apperception Test. Here, clients are shown a series of pictures depicting various scenes. Anywhere between 10 and 20 pictures can be shown to a client. Clients are then asked to describe what's happening in that scene. What led up to that scene? In other words, what was the action or the dialogue that took place right before this image was captured? What will the outcome be? Playing it forward, what happens next as a result of what you saw in the image? And then finally, what are some of the characteristics or ideas of these characters? What are they thinking? What are they doing? What is their personality like? Here, clients are asked to put themselves in the mindset or in the shoes of the characters in this image or scene that they're viewing. As the counselor, your goal is to pick up on trends in responses. Are there any themes that are repeated throughout? Here are the directions that are used for the Thematic Apperception Test. They're standardized directions, meaning counselors are required to follow the script. The script is as follows. I'm going to show you some pictures. I want you to tell me a story about each picture. Tell me what led up to the story. What's happening? What the characters are thinking and feeling? And what will the outcome be? Like with the Rorschach, the counselor's job is to record the complete responses of their clients. So here are some examples of Thematic Apperception Test images. With each image, clients respond what it is that they think just happened, what's happening in the picture, what's going to happen next, and what the images are thinking. In terms of the Thematic Apperception Test, we look and see who the client identifies as the hero. Who does the client identify with most in the image? What are the traits or characteristics of that individual? What is it that that hero needs or is trying to accomplish? What's going on that may be preventing, interfering with the hero achieving their goals? What's the outcome to this? And what themes constantly keep coming up across pictures? Is there a theme of depression, angst, anxiety, difficult relationships? Again, these are all indicative of underlying issues or problems that the client may be dealing with in their own lives. These instruments that I just described are a sample of the projective personality assessment instruments available. Some are available for your use as a master's level counselor. Others require advanced training or a degree in psychology. Other instruments you may see, the Blacky pictures is for use with children, and it helps clinicians understand how those children have been shaped by the concepts underlined in Freudian psychosexual development. So, progress through the stages, oral, anal, phallic, latent, and genital stages. Another example is the Rosenwig Picture Frustration Test. Here, clients are shown images of people in frustrating situations, and they're asked to respond how they would feel in that situation and what they would do to get out of that situation. The Draw a Person test asks an individual to draw a person, and scoring is done based on several different components: the size and proportional dimensions of the image, the detail included, whether it was anatomically correct, facial features are in the right places, and the word association test. We did the word association test at the beginning of the semester, where I gave you a word and you were to respond with the first word that came to your mind. And we scored these by looking at whether clients' responses reflected representation, a definition, a predicate, or an opposite. Collectively, there are many advantages to these projective tests. For one, because of the ambiguity or vagueness of their construction, test takers don't know how the information is going to be used. So it's difficult to fake a certain way with these tests, not knowing how they're scored or how responses will be utilized. This ambiguity also allows clients to respond in less defensive manners. They feel less on the spot, like they're being quizzed or interrogated. And it leads to the facilitation of a greater sense of rapport. Clients and counselors truly get to know one another at a deeper level than if they had just used structured personality instruments. A drawback is the difficulty in interpreting responses. Because they are highly subjective, it's difficult to sometimes understand what they mean and how they should be interpreted. There's very poor reliability and validity with these instruments, and that's to be expected. It's a vague stimulus to which a client is responding. Everyone's going to see it a different way. And finally, depending on the instrument you use, it may be time-consuming for you to score and interpret that instrument. So you need to be aware of the limitations you have with your clients in terms of session length and also number of sessions you have. When time is a luxury, it may not be practical to use some of these approaches. And finally, when assessing clients using projective techniques, it's important to remember behavior is a function of the interaction between a person and their environment. In other words, the way a person behaves, what we observe, is not necessarily who they are as a person. Rather, it's an interchange between who they are as a person and the current situation in which they find themselves. Different situations, depending on how they're perceived, may skew what it is a client does or says in therapy. You may have a child that's very brilliant, but is not a good public speaker. And so if you were to ask them to get in front of a large group of people and participate in a quiz show or academic challenge, they may not fare too well. Their behavior is a combination of who they are and the particular environment they're in at that time. Knowing that, it's important that we also consider relationship dimensions, how people are connected to others, to situations, to objects, how personal growth occurs. And finally, system maintenance or change. How do these experiences, ideas, and new knowledge either contribute to a person's understanding of who they are, or alter or change who it is that they thought they were, but now know differently? So like with the other types of personality assessment approaches, and really assessment of all types, it's really important, critical even, that you consider not only your client, the individual, but also the situation and the environment from which that client comes and that client will be returning following therapy.